Torbay Community Helpline. My name's David. How can I help you?
What sort of things are people calling up about, David?
Mostly it's people who are still in isolation, although medically they don't need to be, but they are very concerned and very frightened, and we get a lot of those calls. We also get calls about how to get tested, because of course the test stations are so overloaded, and mainly a lot of advice rather than actual practical help.
David, what sorts of issues are people calling up about?
But these days, if they're looking for advice, there are a lot of very nervous people still out there who, whilst medically they don't need to isolate, they still want to stay in isolation. They're very disturbed and worried about being out there.
David, are there any calls that really stand out to you?
There is one. We have telephone befrienders. They call and befriend very isolated people that we look after. And one of them called me one morning to tell me that she'd been trying to get in touch with her contact for 2 days and hadn't been able to. She's very worried because the lady was living on her own and she knew she would not be out and about at all. So I checked our records and I found that we had another telephone line recorded for her, a landline, I called that. And I got through to her, but I found I was talking to a very disturbed, distressed person. I chatted to her for a little while, trying to ease her a little bit. But when I rang off, I immediately phoned our supervisor, and she phoned our mental health partners, who immediately followed up. And after that, you never hear any more. That's the end of the thing for yourselves. But I've always wondered, you always wonder what would have happened if that telephone befriender hadn't called us, and it shows the importance of the work that they're doing as well.
With that in mind, what do you think it means to people to have a service like this?
The thing that they always say to me at the end of the call is, thank you so much for being there.
So things have changed over the 7 months that the helpline has been operating. What sort of things have changed, and what's the difference?
Yeah, in the early days, people were needing prescriptions delivered and food deliveries, but now the pharmacies and the supermarkets, etc., have got their act together and they're doing those deliveries, which is fortunate because most of our volunteers have gone back to work anyway, and so we can't do those deliveries. So now it's more advice than anything else. And people still do need some emergency physical help, but mostly it's advice that we're handing out.
Tracy, in terms of numbers, how many calls were we getting on average a week, and how many was it at the height of lockdown?
At the moment we've got about 250 calls a week. At the height it was 900, and I think we've taken just over 15,000 calls in total.
And how many people have you helped in total?
3,500 plus. I would say that I also include in that the volunteers, because actually we helped by giving them a purpose. There were 800 of those who were desperate to do something, and the rest were people that were in need.
And what sort of things were you helping with?
Oh, practical things. So we were doing shopping, we were collecting people's prescriptions, organising food parcels for them, and then gradually, as the kind of longer term impacts of the pandemic started to hit, we really responded to the other things that people needed. So whether that was advice with finances, whether it was helping people who were experiencing anxiety or mental health issues. We helped people who were looking after families at home when the schools were closed. And we tried as much to find somebody within the voluntary sector that could provide whatever that caller needed.
What do you think would have happened if this service hadn't existed?
I think Torbay would have been in a very different place. I think we would have had a lot more anxiety amongst people. I think that we would have had, a much longer recovery period. And I suppose it's a little bit frightening to think about what might have happened if we hadn't been there, because I think the callers were probably some of the most vulnerable people in Torbay. They already had a number of challenges, most of them, before the pandemic started. So it doesn't bear thinking about, to be honest, if we hadn't had the helpline there.
So what's the long-term plan for the service? Does it need to keep going?
Well, the helpline, we would like to keep going. It has been a fantastic opportunity for the community of Torbay to tap into everything that the voluntary sector can offer. And it's been a fantastic partnership with a number of voluntary sector organisations behind the scenes. So we want to make it a one-stop shop, if you like. If you don't know where to go in Torbay and you need some help, then you call that number and we'll find the right organisation for you. That for us is the future. And that, I think, is the legacy and something positive that has actually come out of the pandemic.
It clearly has been successful. And do you think other parts of the country will be looking to us and looking to copy this?
I think they may be. We've certainly had a number of different areas that have contacted us to actually find out how we've kind of pulled this off. So yeah, I would like to think that they would be copied elsewhere, and we'd be really happy to help other places do what we've done.